Thank you all for joining us today. My name is Brian Krenzer, VP of Marketing here at Verisys, and we're very excited for today's webinar on the evolving role of pharmacists in current health system. Would like to introduce you to our presenters today. First is Anne Wrighton. Anne, would you like to introduce yourself?
Sure. Thanks a lot, Brian. I'm delighted to be here today. So my background is I have an extensive history in the healthcare and life sciences space, including about 20 years plus at IBM, where I was the healthcare and life sciences VP of sales. So what I bring is an understanding of the business issues in this space and also how technology and data and solutions apply. So I'd like to turn it over to Amy to introduce yourself and maybe tell us a little bit about how Verisys fits in the pharmacy market.
Thanks, Anne. Hi, everyone. I'm Amy Anderson. I'm the Chief Customer Officer with Verisys. Been with the company now for about 10 years, and really my focus in the organization is understanding the use cases that are taking place in the different healthcare markets we serve, monitoring some of the regulatory compliance changes, the changes in scope of practice around the practitioners that we're monitoring and screening and credentialing, and then just ensuring that our solutions are meeting the needs of our customers and the market as a whole. And ultimately, today we're going to be talking specifically about the pharmacy market and how we're providing services there, and ultimately the use cases that are changing around scope of practice of pharmacists, pharmacy technicians, and in some cases, how that is shifting the payment cycles, revenue models around those practitioner types. So just to begin, I want to talk about data and how data is leveraged inside of these use cases. So as many of you know, Verisys provides provider data for a number of use cases spanning from credentialing to background screening and initial hiring screening, as well as ongoing monitoring. We also have a portion of our organization that compiles and delivers provider data for provider lookup tools, master data management inside of health plans. And then we have use cases in the transactional space, revenue cycle, and payment integrity, where our data is leveraged just to ensure that prescribers are in good standing, as well as providers that are submitting claims for payment. So, and if you look at our data overall, one of the data sets that we provide very heavily and in multiple use cases across the pharmacy market is Verisys. Verisys is a Verisys branded data consistently as those primary sources are publishing, and then we're monitoring providers, employees, contractors, vendors, really any entity that is paid by one of the pharmacy organizations that we serve against that data set on an ongoing basis. We also are monitoring individual credentials. So we will complete a credentialing event initially for licensed practitioners, and then we monitor any dynamic data elements. So for instance, education doesn't tend to change over time as frequently as a license would. And so we're monitoring that dynamic element, the license element, for status changes and expiration, as well as some of the other data elements tied to these practitioners. And then we do serve, some of the largest pharmacies in the United States. And in terms of our CDO services, and we're supporting enrollment, credentialing at really every level from Joint Commission to NCQA, and supporting both the health plans as well as the delegated entities, in this case pharmacies, in ensuring that their clinical practitioners and now pharmacists in many states are appropriately credentialed, not just to provide care, but also to be enrolled for reimbursement. You can go to the next slide. So, Anne, would you like to go through the agenda?
Sure. Thank you. Thanks, Amy. So what we're going to cover today are some pharmacy trends, particularly how they affect pharmacists and pharmacy technicians, what the implications are of some of these trends, and we'll talk a little bit about some of the solutions that Verisys has built to respond to these as we've been working with our pharmacy clients. And we'll have a bit of time at the end for Q&A. So do you want to go to the next slide? Thank you. So what we look at for the 4 areas that are having trends in terms of changing the pharmacist role are, first, an incredible pressure on the healthcare labor market. And this is being exacerbated because of the aging of the US population. So, even more so than today, we're going to see additional challenges to having enough healthcare workers to satisfy the demand. The second is the trend of how the drugstore footprint itself is evolving and how services inside the store are changing. The next one is how pharmacies are becoming health and wellness destinations and really going beyond simply dispensing medication to really looking at proactive healthcare. And lastly is the impact that precision medicine or specialty medicine is having on the pharmacy ecosystem, because these are more complex medications that are really changing how drugs are distributed. You can go to the next page. So we all are aware that the pharmacist role has been elevated through COVID, but we're also seeing how that's going to change even more because of the healthcare labor pressures. What you can see here is the primary care physician shortage is currently sitting at over 17,000 of the primary care physicians that we're missing in our ecosystem. And that's expected to grow to over 48,000 by 2034. But it's not just the doctors where we're having this struggle. We also have the struggle with nurses, again, tied with COVID, where we've lost quite a few nurses to the profession because of the struggles that COVID presented. And we're no longer seeing the rate and pace of nurses joining the healthcare workforce to make up for the gap. The other area that is pressure on the healthcare system is the shutting down of some hospitals. And this is having an effect across, want to go back? This is having an effect across the board with something called healthcare deserts. Healthcare deserts are something that affect over 30 million Americans today, in which it takes over an hour for them to get from where they are to a healthcare facility to meet their healthcare. So the way that pharmacy chains are responding to this healthcare labor pressure is twofold. One is they're starting to address the wages of pharmacists and pharmacy techs, and they're also looking at changing what the administrative burden is inside the pharmacy to free up pharmacists to do more high-value services. So we go to the next page. So if we also consider what's changing in terms of the patient population and what patients are used to, the traditional one-on-one doctor relationship with a primary care physician is starting to change, especially for folks who are a younger generation, and they may not have that one-to-one doctor relationship, which creates a gap in terms of where do you go to get your healthcare? How do you enter into the healthcare system to get the services that you need, especially getting into specialty services? You can go to the next slide. So that's what's helping to elevate the role of the pharmacist. And we see that by a survey that has recently been published that says 58% of folks who would be willing to visit their local pharmacy first instead of going to a doctor for non-emergency medical issues. And this is something that is actually ideal for the pharmacist community because they're well prepared to take on additional healthcare services as opposed to simply dispensing medication. Something that we saw in COVID in particular, because during that crisis, the pharmacists and the pharm techs were really forced to change their role and take a much broader position in delivering healthcare. The other interesting thing is the pending legislation that supports this move to elevating pharmacists' role in the community. The first one is around, it's called the Equitable Community Access to Pharmacists Services Act, quite a mouthful. And what this would do is ensure that Medicare beneficiaries have access to pharmacists providing vaccinations, testing, and treatment services. There's another piece of legislation called the Medical Nutrition Therapy Act, and this would expand pharmacy services to include nutrition, counseling, and allow pharmacists to refer patients to other resources to cover things like diabetes and heart disease. So, this kind of legislation is really gaining a foothold, and it's not just one party or the other. It's really a bipartisan effort because of the challenges of the healthcare deserts being across the country. And this is also laying the groundwork for the pharmacist's role to become even more elevated. I think it's also important to step back and look at the environment with which this is happening in the retail pharmacy market. We're actually seeing significant growth here. So when you look at where we are today at 570 billion, growing to almost $1 trillion by 2032, this is being driven by the continuing aging of the population and also by the specialty drugs that are starting to hit the marketplace and increasing the cost of the medications. So we can continue to see this trend of a very healthy retail pharmacy market. Next page. So what are the pharmacists actually doing on the front line that's different? And you can begin to see here, they're doing testing and initiation of treatment services. They're doing much more with vaccines. They're not just doing flu and COVID now. They're doing many more types of vaccines depending on the state that you're in. There's tuberculosis testing and HIV prevention. So a whole host of services that are already happening. With the legislation, we'll see even more. We might want to look to Canada as an example of where this is going, because Canada, with their much broader geographic spread and smaller population, they have this challenge even more so than the United States. So they're a bit ahead of us in terms of what they are having pharmacists do, including eye care, dermatology. They're even able to renew or extend prescriptions. So that's the direction that our market is likely heading as we start to see legislation that empowers pharmacists to do more and more. We can go to the next slide. So I was going to turn it over now to Amy to discuss some implications and takeaways of what we've just heard.
Yeah, and one thing I want to call out, if there's questions, please make sure you're asking them. We can answer questions as we're going through this, but all the information that Anne shared, some of you who are attending are likely part of our pharmacy customer base or are potentially looking at services in this space. I would say that we are seeing this move significantly in very specific states, but across the United States as a whole. We are seeing this scope of pharmacists change. I would say there are implications from a bandwidth perspective. So in order to enable pharmacists to treat patients and for more and provide more services, there are implications on the administration side. So pharmacists are already very busy. If you talk to a pharmacist, this makes them very nervous, rightly so. So in order to evolve that scope, we have to see the support structures around pharmacists also evolve. And we are starting to see some organizations be fairly proactive about this. So maybe they're looking at using AI for some of the processes that are manual now, but could be decided with AI, so to kind of balance that or enable that workflow. We're seeing some optimization around technology to deliver more real-time data decisions, and basically all this focused on just freeing up time. But also we're seeing the same type of scope enhancement around pharmacy technicians and some poking and prodding at what that scope could hold and carry. And this is not dissimilar from what we've seen with other types of professions in other markets. So, we've seen this happen with nurse practitioners and nurses over time as well, where their scope has expanded. We expect this trend to continue. And in pharmacy, I would say, as it relates to specific services that we're seeing the most movement around, I would say screening and credentialing. This is something that's very fascinating, a fascinating evolution inside of the pharmacy market, and also bridging from some other provider focused markets historically. We're seeing staffing organizations get more proactive about credentialing, as well as ongoing monitoring, not just of existing credentials, but monitoring of credentials that could exist or might exist. So, for instance, with a pharmacy technician, you may be monitoring their pharmacy technician license in states where those are regulated, but you might also be monitoring for an event that could occur where a pharmacy technician may get an immunization certification, right? And so we're starting to see staffing organizations get involved there, and we're providing that service in those spaces as well as directly to our pharmacy partners. We also are seeing just more comprehensive screening and credentialing processes than we have historically. So we might see in a traditional credential event around a pharmacist, we might check their licensure, their DEA registration, look for exclusions, debarments, or license disciplinary actions, historical or current. Now we're getting more requirements inside of our credential screening and even the application gathering around additional certifications a pharmacist might carry, that may or may not be state regulated, but maybe just private certifications that are held that would ultimately enable additional services that they could offer inside of that pharmacy, and basically just adding more value to that candidate and that new hire. So we're seeing that type of trend around credentialing processes as a whole. We're also seeing a fairly significant amount of interest in full NCQA level credentialing, which historically is a level of credentialing that's used mostly for health plans. It's used across healthcare, but primarily for health plans and enrollment. And all of this is really for the pharmacy organizations to prepare for individual states to allow enrollment and reimbursement of a pharmacist inside of the pharmacy setting in order to enroll those providers, whether as a pharmacy organization you're setting yourself up as a delegated entity, or you want your pharmacist to just enroll directly with the health plans. That level of NCQA credentialing will be required. And so making sure that you have all the information collected as part of a new hire, pre-hire credential event, so that later you can enroll that provider more effectively and more quickly. We're seeing a trend in that direction as well, just in terms of data coverage and data collection. The second thing I want to talk about is just continuous confirmation of a workforce. So this gets into monitoring, and historically, monitoring has been more of a check the box in most organizations to just maintain compliance with some of the federal regulations around ongoing screening and monitoring for exclusions and debarments. At the state level, there's additional requirements around license disciplinary action. And what we're seeing more and more is, again, looking at that workforce, the vendor population, the entity population, to both screen for adverse actions and exclusions, as well as new certifications. So maybe you have a clerk working in a retail pharmacy store that has decided to get their pharmacy technician license, and now they can be moved, right? They can work in two places. Or we're seeing even more broadly, looking at the licensed population, maybe a pharmacist where historically you might be checking for licensure in the state where you have them working, but we're also now searching for all the licenses that pharmacist might hold, so that there's more flexibility in the workforce. Maybe they can work across state lines, or again, if they have additional certifications on top of those licenses, they can work not just in multiple stores, or have you may have a new floating pharmacist, but a floating pharmacist with additional clinical credentials. And so it's really enabling not just new revenue streams, but a better workflow in looking at more holistically at all of the data around that practitioner, as well as the credentials they might obtain. And then finally, just looking at health plan credentialing and reimbursement as a whole, we are seeing this move. This is inevitable. We saw this years ago with other, practitioner types that had not historically enrolled. Health plans do solve for this, and they already are. Where many of them are our partners, and we've already had these discussions and how they're considering pharmacists, how they're looking at the enrollment process, how they are enabling pharmacy organizations that are not already set up as delegated entities, how they're enabling that setup, as well as just educating the pharmacy market on how to enroll, how to manage reimbursement, how to manage eligibility, and manage the credentialing level and process that's required to get a provider enrolled and maintain that enrollment. So lots of trends there. Anything else you want to add there, Anne?
No, that's great. Thank you. Thank you. Okay, so now we're going to shift a little bit to the evolution of what's happening to the retail pharmacy itself. So, one of the big things that's happening, as I think we can all relate to this, is the number of customers who are moving to mail order or online pharmacies for getting generic, especially generic medications. And again, looking at the surveys on the market behavior, 67% said that they would prefer prescriptions by mail if that could cut costs, and 81% say they would rely on digital platforms to interact with their pharmacy. So the drugstores are responding to this by offering online and mail order solutions, which is having an impact of the inside the pharmacy in terms of the amount of medications that are being dispensed. One of the elements that starts to affect that is looking at how many drugstores are really needed. Some time ago, there was a real proliferation of drugstores across the marketplace. And in fact, I was counting the ones across a road on our main street in our neighborhood, where we have 2 miles, we have over 8 pharmacies that are represented, which is an incredible saturation. And what we begin to see now in the pharmacy space is some rationalization of those number of pharmacies. And we'll likely see more store closings as they look to have the right kinds of stores in the right locations with the right services. And what we're hearing in the marketplace too is the drugstore chains and even the pharmacies that are inside grocery stores are asking questions like, what do we want to be? And how do we want to sell? So I think we can see that there's going to be more change coming. If we go to the next slide, you can see some of the themes are all around adding additional services, additional healthcare services, and expanding healthcare services that are being offered, including things like primary care, telehealth, and wellness. And the pharmacies and drugstores are also thinking about how to deal with the pharmacy adjacent businesses that they've bought. So, for instance, the acquisition of Walgreens, who acquired Village MD and CareCentrix, and CVS, who acquired Aetna, and Walmart, who has changed course on their healthcare recently with their health clinics. They're going to streamline those down and have less of a presence with the health clinics and do more inside the pharmacy with healthcare. So this is really still an evolving model, but really starting to see what's necessary inside the store as the pharmacist role evolves, what's necessary inside the store to support that evolving role. Go to the next slide. So one of the key themes that we're seeing is pharmacies wanting to become health and wellness destinations. And this has to do with going upstream of the diagnosis and not being reactive only to healthcare treatments, and having pharmacies really think about how to be proactive. So they're going beyond dispensing medications and looking to expand into more holistic and personalized care. What's really cool about this is the pharmacists are really positioned to help with these services because their skills go far beyond simply dispensing medicine, and they're able to really become a trusted advisor on how to avoid diseases. So that really leads to this transition to a more clinical, proactive consulting model instead of the dispensing of medicine only. An example of this is one of the major grocery store chains that has pharmacies has actually stated their new mission is to be able to improve outcomes by creating solutions that combine health, wellness, and nutrition. And this makes a lot of sense, especially in a grocery store environment where you could think of food as medicine, and you can start thinking of the pharmacist, of that person being able to advise on, well, how does nutrition play in my proactive healthcare role? Okay, thank you. So the last trend is all around precision and specialty medicine. And this is really interesting because when you think of traditional medicines coming in through the pharmacy, you think about filling a bottle with pills. And this is really changing with the advent of specialized medicine. And there's a couple of characteristics that you can see here that make specialty medicines different. The first is they're treating chronic, rare, or complex diseases. The second is they're generally injectables, but they're not necessarily self-administered. So they're not something that you would take home and do the procedure for yourself. There's additional care in the chain of custody because these medications are more complex. They might require refrigeration. They might require other kind of special care to make sure that the medicine is ready for the patient at the time that the patient needs it. They're also very expensive and can be over $6,000 annually and require reimbursement assistance. And lastly, they're very extensive in terms of the monitoring and the patient counseling that's needed. So again, a very different profile of the kinds of medications that are being prescribed. And you might think that this is, a small niche area of the spend in the marketplace. But if you go to the next page, you can see this is really accounting now for over 50% of the spend in terms of the medications. And this has really grown since 2012. It started to kind of even out now, but the expectation is it will continue to grow again because of the amount of investment that is happening in the marketplace. So this trend of more tailored medicine is something that's very attractive to the venture capital market space. The other thing that's happening here is the advent of specialty pharmacies, and that's something that has changed recently as these medications have changed. There's now over 1,800 new types of specialty pharmacies that have been accredited by URAC in order to respond to these specialty medicines being prescribed. And they're owned by companies like PBMs, like hospitals, like retail and long-term care chains, and there's independent pharmacies that have started up. So a lot of change happening in terms of the types of medications that are being coming through the healthcare ecosystem and how that will affect the pharmacists. So we turn over now back to Amy in terms of the implication for these changes.
Yeah, so if you're looking at the evolving role of the actual location and in person care, I would say there's definitely some similar implications in the I would just say the evolving scope of individual practitioners, and that how the store is being used will change. And what we've seen happen with our pharmacy partners, with our PBM partners, and again, even with our provider partners and emerging technology partners that we're working with, is an evolution of not just what can be treated, so looking at scope, but inside of the drugstore, also looking at on-demand options. So, what could that location be used for and when? So really trying to optimize in a similar way that other markets have done. So think about Uber, right? That's a really basic example of an on-demand option. We're starting to see on-demand options show up in the pharmacy space and actually in other healthcare markets as well, but just trying to leverage the actual store location for what it's needed and when. And so that's something that's really interesting in terms of the data and credentialing work, data flows around that. Definitely looking at more credentialing around the actual store locations, as well as DSCSA. So knowing your trading partners, understanding the workflows and the risk around wholesalers and providers, distributors, and also The flip side of this, the less positive side, is understanding the new and very real risks around doing business in this way. So as there's more technology introduced, as there's more uh, work being done not in person, there's also a higher risk of fraud, waste, and abuse taking place. And so just making sure that you have the right monitoring and controls around these new partners or these new models where you're leveraging store spaces, you're letting people in. We're seeing more interest in provider data being leveraged for, historically in what the provider market would call badging, right? Who's in my hospital at a given time. The same concept is existing inside of the store location. So as they're introducing new care types and care providers inside of the store locations, making sure that they have a similar concept to badging, like who is in my store at what time, which vendors are engaging. And as my employees are taking on more scope of care, making sure that they're in the right place at the right time with the right credentials on any given date of service. So that kind of moves things into a more real-time model versus the historical model where an event takes place and then you run payment integrity cycles or screening models around that event. We're seeing more work happening in real-time events. So is this provider, this person that's coming into my store, this location, appropriately credentialed today, in good standing for government reimbursement today, et cetera? And we're seeing that kind of shift towards how data is leveraged to make decisions in real time for who is leveraging the store or providing care in a store location. And we see this obviously outside of pharmacy as well, but definitely in the pharmacy space.
Great.
Yeah, go ahead, Anne.
Yeah. So just to kind of sum up what we see as these new models change, we're going to continue to see the role of the pharmacist evolve and grow in scope. And we'll also see that these are going to drive new solutions that are required inside the pharmacy. That's going to drive a need for investment. And part of the themes that we're seeing is how can we help our clients grow revenue or take cost out so they can free up funds to invest in these new models as the role of the pharmacist changes. So I thought what I could do next is we'd go through some of the solutions that Verisys has built in order to address some of the concerns of our clients. So there's 4 of these solutions, and they're each designed either to help increase revenue or reduce cost. And I'll touch on these each briefly, and then we'll go into each one. So the first one is around health plan enrollment, and that's around increasing revenue by enabling the pharmacist to actually perform the services. The second is enhanced prescriber file management, where we really make it more affordable to be able to aggregate prescriber files more productively and accurately. The third is the real-time pharmacy verification for eligibility. And last is the DSCSA solution for trading partners. So if you want to go forward. So for health plan enrollment today, as Amy touched on this a little bit, it's really important that as the pharmacist becomes more of a healthcare provider, he or she is going to have to interact with the payers in order to get paid. And today you might run into a situation where a payer is going to decline service because the right credentialing isn't in place. So going to the next page. What we can see, what Verisys is able to do is to do an upfront credentialing of the pharmacists on the expanded services that the payer is going to pay for, and really understand from the payer's perspective what credentialing is required. And as Amy had mentioned, NCQA is one of those criteria that is the most common that we're seeing. So how to be able to credential the pharmacist for those services. And this shows that we can do this both in the pre-hire, so before someone is hired, we can get the credentialing done. And then after post-hire, the credentialing can also take place, and re-credentialing over time, as this is something that just doesn't happen once, but in some cases 2 years, in some cases 3 years, needing to be re-credentialed. And then the next solution is around prescriber file management. And this is all about taking cost out so that you can free up investments into new pharmacy solutions. Today, what a lot of our clients are dealing with is a need to manually update the client sources that they're working on to keep their prescriber file management up to date. And if we go to the next slide, you can see what Verisys can do is by providing the ability to ingest all of those files, cleanse them, review them, and augment them, we're able to take a significant amount of the manual effort out of the equation and enable an enhanced prescriber file that's much easier for the organization to manage. Going to the next one. And this is something that we do extensively with our payer community today. So it's something we do at scale for millions and millions of records. So working with our pharmacy clients, this is something that we think can really scale for them and help them take cost out of their environment. Then the third solution is around real-time payer eligibility. And this is an interesting one because, again, as pharmacists start to perform services and interact with the payer community, they need to be sure that the prescriptions that are coming through are eligible for reimbursement. And some of the risks that happen if they accept and process a prescription that is not eligible is their member safety can be at risk, there's reputational issues, and there could be a fee of up to $10,000 per prescription for ineligible prescriptions that are presented to the government for payment. And what this means is it can rack up charges of over $1 million a month in terms of ineligible payments. So what Verisys has done is come up with a way to, in real time, be able to check the veracity of the prescriber and make sure that they're eligible for that prescription at the point of prescription. So this can happen every time in real time to make sure that none of the ineligible prescriptions take place. And this also prevents a whole workflow of adjudication that's no longer necessary. And then so we can skip this chart there. And the final one is the DSCSA. And this is the Drug Supply Chain Safety Act, which is around tracing and verification, identifying where in the drug supply chain the safety of the drug is evident. And going to the next slide, as we look at the trading partners, is where Verisys has a solution that helps to ensure that all of the trading partners that a pharmacy is dealing with have the correct licensure and all of the FDA approvals. So going to the next slide, you can see these are examples of some of the licenses and the approvals that we provide across the DSCSA regulatory environment, which goes into effect at the end of this year. So that's a summary of the solutions that we have, and we wanted to turn it now over to some Q&A. Any questions, Brian, that you've seen?
Yes, a couple questions have come in. The first one is, with these solutions that we're talking about, can you integrate them into your existing workflows, and how would you do that?
Yeah, that's a really interesting question. We have what's called a unified API, which is a modern API that allows all of these functions to be integrated into workflows, automated workflows, and many of our clients are already doing that today. They can integrate into other applications as well as custom applications that clients may have built so far in their operations.
So just to give a couple examples of this, we have seen, for instance, the real-time data is integrated into like a claims edit process or the PBM eligibility workflow. We've also seen, for instance, just the ongoing monitoring or the credential monitoring elements implemented and integrated with even scheduling systems. So if we return on a day that a license status has changed, that pharmacist is not scheduled for work. And so we see these data options integrated into multiple types of workflows, but there's a significant amount of flexibility around where the data can integrate, as well as this gets maybe a little more technical, but whether you want your system asking us for information or if you want us pushing information into your system. So like using webhooks, we can tell you when something has changed, or tell your system to trigger a workflow when something has changed that might be meaningful to your business.
Excellent. And that kind of leads to the next question, which is, does Verisys handle license verification for both pharmacists and pharmacist technicians?
Yes, we do. We actually monitor all license types in the United States. So all states, all jurisdictions, all license types. But yes, pharmacy technicians and pharmacists both fall into that category.
Fantastic. And the last question we have currently is, do we work with telehealth organizations, and how do we work with telehealth organizations today?
Oh, that's a great question. Yes, we do. We work with a number of organizations that are supporting telehealth providers. So we have a number of areas where this is relevant. I would say one of the areas where we have sort of differentiated ourselves is the credentialing of telehealth providers. So the initial credentialing and re-credentialing of a telehealth provider obviously has some level of complexity in terms of the states where they're licensed to provide care. And oftentimes this comes up specifically around nursing or behavioral health, but we do see a different level of credentialing that's required, by state, by profession. And since it's a telehealth provider, those requirements can be different by state, by profession, and by that individual, depending on the states where they're going to be working. So we are able to do a fairly significant for telehealth providers, and at that level of complexity, as well as the ongoing monitoring requirements for each state where that provider is practicing. The other thing that does come up with telehealth is similar to what I was talking about with like a pharmacy technician that might get a new license. With telehealth providers, this is fairly common. So think about like a nursing compact license. That's very similar concept to what we're seeing in pharmacy, and depending on the pharmacy retailer, you all have nurses. so we see this on both sides, but we are also in some use cases tracking for net new credentials. So not just monitoring the credentials that were provided during a credentialing event, but is there a telehealth practitioner that now has a new license in a new state, and they can now provide services in a new state inside of whatever distribution or care model you have in place? Great question.
Excellent. That is all that we've had submitted so far. So again, any questions? Now's a great chance. Otherwise, I think we're about there.
Great. Well, thanks, Brian. This has been a very interesting to have the discussion, and we hope to have other webinars like this in other areas. So any closing thoughts, Amy?
No, just thank you everyone for making time. And of course, if you have any other questions that come up as a follow-up, feel free to reach out to Anne or myself, and we're happy to answer any questions you have. Thank you so much.
Thank you.